Hello, my name is Lucy Brooks and I am 19 years old. I have Ehlers-Danlos Syndrome, Postural Orthostatic Tachycardia syndrome, chronic intestinal pseudo obstruction and intestinal failure. As you can see, I've got very complex conditions. I'm fed straight into my bloodstream, called TPN, through a line that sits just inside my neck and down into my heart, obviously because my bowel has failed. I also have a tube, a gastrostomy or PEG, into my stomach, which is used for medication and draining, as well as a stoma, an ileostomy, so I have to wear a bag to collect waste, and also soon I'll be having a suprapubic catheter, which is a catheter into the bladder placed, as my bladder has failed. I have a lot of doctors and specialists working on my quality of life as my life expectancy is limited. The TPN has potentially life-threatening complications of liver failure and the special line that it's delivered through, infections which go straight into the bloodstream, which can turn into septicemia. These are both fatal complications. The only cure for the intestinal failure is to have a bowel transplant or a bowel and multiple organ transplant, but it will not cure it, it will just stop me having to have TPN. I live at home with my mum and my sister, who's 3 years older than me. We also have a dog and 2 cats. My mum does most of my care, which is a 24-hour job, although she does work full-time, so we have carers that come in while she's at work, but they can't do any of my medical care due to various highly specialised medications and so on. I have a personal budget which pays for the carers during the week, and hopefully now we just have my budget reviewed to include more evenings and weekends and nights to hopefully take the pressure off Mum, although she will still have to do most of my complex care needs because of the various complications. The only place that I can go that will do all of my medical care is a hospice, young adult hospice called Jack's Place, which is 2.5 hours away, but they will be able to give Mum a complete rest, so we're just waiting for our turn to go there. As I said before, the conditions have a huge impact on my quality of life. I am in constant pain, for which I take very strong painkillers. I take drugs for anti-sickness, as I suffer a lot of nausea, and other drugs for various other ailments, such as my low blood pressure, my high heart rate, and acid reflux, and so on. The impact of my conditions on my life is not just on my life expectancy, but also my quality of life. I am in constant pain, for which I take many different strong drugs to try and control it. The pain is in my joints and in my gut. The joint pain is caused by dislocations, and as my joints dislocate very easily and very frequently, and also gut pain, which is caused by the intestinal failure. The other symptoms I suffer with is low blood pressure, when I sit up especially, high heart rate, poor temperature regulation, poor healing and easy bruising, as well as mouth ulcers and headaches. Quite a big commitment to keep up with all my medication. I cannot eat, as I cannot swallow the food and I cannot digest and absorb enough nutrients from it, which is why I'm fed into my bloodstream. Eating has not been part of my life for about 3 years now, and obviously eating is a big part of everybody's life, but not for me anymore. I can drink though, although what I do drink is not absorbed properly, so I just drink for pleasure, although it does cause a lot of pain. I have trouble sitting up, as when I sit up my blood pressure drops and my heart races, which means there's not enough blood getting to my brain because it's all pooled in my feet. This causes a lot of symptoms such as passing out or feeling very, very faint when I'm sitting up, which means I can only sit up for short periods of time. This means going out and so on is really difficult for me, so I spend most of my time in bed. I was born with Ehlers-Danlos, although we did not know I had it until it became severely disabling at 14. Then I was diagnosed at age 15. My consultant that diagnosed me said I could have been diagnosed about age 7 if we had come to him, but I'm glad we didn't know, because I had been wrapped up in cotton wool. I used to enjoy riding, playing the piano and doing netball, so I'm glad I got the chance to do all those things, as some people don't get that chance. Ehlers-Danlos is hereditary usually, but there's no family history, so I'm something that's known as a spontaneous mutation. Very nice. When I do manage to go out, being in a wheelchair is very limiting, because not many places are actually fully wheelchair friendly. Some places don't have ramps, dropped curves aren't dropped properly, so you feel like you're jumping off a beachy head. You know, doorways aren't wide enough, they have, you know, not enough room down corridors, you can't turn into doorways, they're inappropriately placed, different sets of equipment and filing, storage and things like that, and it's really, really hard to find places that truly are wheelchair friendly. Another limitation for me is always being connected to a pump, as my TPN, the special feed into my bloodstream, runs over 19 to 21 hours, and then I have a drug infusion in between which runs for 3. But being connected to a pump isn't so bad. When I'm in bed we stick it on a drip stand, but when I'm in my wheelchair it's got a special rucksack and we just throw that on the back. It's quite easy really, because some people have to carry it on their back, and 4 litres to carry is not easy. As I said, we try to get out as much as possible, and I have a puppy Molly who I enjoy taking out. She really is the best medicine. I do enjoy photography as well, so when we're out, it's usually we combine walking with photography, which I really, really enjoy. It was a passion of mine before I got ill, so now I can do it again, which is brilliant. For enjoyment, I also keep a blog called Overcoming Obstacles, a Facebook page called Lucy's Life, and my dog Molly also has a blog and a Facebook page, which I keep updated every day. As I said, I live with my mum and my sister, and I'm lucky that I have family support, because some people do not have that. Part of the problems we've had with care is that they think that everybody needs the same things, but we're all individuals. We have different wants, different needs, different conditions, different living arrangements, and that we're not a one-size-fits-all. It's very, very individual. We did try and have agency caring at one point. However, you cannot show 15 different people how to change a bag, where my equipment is, what I need, what medication I take, and so on. You just can't keep doing it, and you never know who's going to turn up half the time. And it's not easy, and the only thing I have control over is who comes into my house. And I don't want anyone. I want people I get on with, I can enjoy having here, and we can do things and we can train them to my needs, because they are employed directly or indirectly, but we have the same carers. As I have care from a private carer that we employ directly through my direct payments, and also I have support from the Jay's Hospice, who have a team of carers who come in and look after me when my mum's at work, and also their nurses to help with a lot of my health care and sorting out appointments and medication.